Dear viewer, I am Dr. Noorul Ain, Assistant Professor, Department of Social Work, University of Science and Technology. Today, we will discuss the principle of social work. What is principle of social work? Principle of social work are the guiding belief and the statement of do's and don'ts. It is basically the norms, rules, and the statement which guides social worker to how to do practice social work with the client. Social work principle. These are the some 7 principle: principle of acceptance, principle of individualization, principle of communication, principle of self-determination, principle of confidentiality, principle of non-judgmental attitude, principle of controlled emotional involvement. Principle of acceptance. Principle of acceptance tells that to accept client as it is, to accept client with their weakness, with their strength, with their uniqueness. We know that each and every one individual is different as her fingerprint. We cannot expect that each and every one is supposed to be same as all the people. So we are supposed to accept accept the client as with their weakness and their limitations, and give a warm welcome and the positive gestures, so that he could feel that I am at a good place, and I can go with explaining my problems and concern, and it's a good place to come, and they can listen, and they can have the possibility to make me come out of the problem. So it's a genuine, we have to we as a social work professional need to be listening with the interest and genuinely to the concern and the problem of the client, and accept as it is. Next one is principle of individualization. We know that each and every one is unique and different, and each and every one has worth and dignity as a human being. So we need to look all the individual differently as per the need of their problem, as per the need of the client. So we cannot have some form of solution, some ways and the means to tackle all the problem of the with all the client, so that all the problem with the client, we have to have the different model, we have to have different lens to looking the problem of the client, and we are supposed to find out the means and the ways how we can solve the problem of the client individually. Treat as a person with the right and need. We have to not to treat the person as a commodity, person as an object. We have to treat the person with the rights and the need. Each and every individual has their own human own right and needs that we need to cater. We need to look for the possibility how that we can solve her problem, how that we can look for the solution to that problem. Next one is the principle of communication. Principle of communication tells that we have to communicate with our client with, quite positively, and quite in a way that he could not be feeling ashamed, he could not be feeling that I am at a wrong place. We are supposed to having the positive talk and try to assist, try to facilitate, to discuss all the problem that they are facing. And if we have any kind of we may communicate this in a verbal or the non-verbal. If the social worker need to follow the principle of communication, that we have to learn, we have to have the knowledge about the culture, tradition and the religion and the background of that client. So if we don't have all the knowledge, all the experiences, that we cannot give our 100%, and they are not going to feel that I can share my all the things. If we are going to if as a social worker don't have proper knowledge about the communication, proper how to communicate to whom, and in what condition, what to communicate, what to not to communicate, what kind of ways of communication may be used for what kind of person. So it going to be a negative impact on the side of client. They could be feel offended with this because the some terms and terminology may be okay with the other one culture, that the same terms of communication and the terminology or the will be abusive in particular community. So if don't have if the social worker don't have knowledge about particular the culture, he could offend that their client. In that case, it is quite pathetic for client to continue with the relationship, continue with that particular social worker. So we need to have the skill in communication, the soft skill, and each and every nuts and bolts of the communication. The next one is the principle of self-determination. The NASW Code of Ethics in 1999 uphold the client right to make their own decision. We know that the client comes with the problem and explain their all the problem, when it is started, how it is started, how this client is facing the problem with that particular situation. So we as a social worker, professional social worker, we have the duty and the duty to facilitate them, help them, assist them to come up with the plausible solution, how they can solve that problem, how they can come out of that problem. It is self-determination is simply the freedom to make choice. We have to give them choice. We need not to impose any kind of decision of our that you are supposed to follow this. If we impose any decision from the outside, that may not be going to be fruitful, that may not be going to be effective for the social for the client. It is going to be less effective. It is going to be negative. This principle refers to the process of deciding by a person or group by their own, without any interference from the outside and from the outside. So we are supposed to give the chance to the client, so they can look for the solution, they can come up with the solution, and since they are come up with the solution, they can live with the solution, they can be positive enough to come out of the problem. So it's all about the principle of self-determination. Next principle is principle of confidentiality. You know, they respect the client right to the privacy. We are supposed to respect the right of privacy to the client. Social worker may know each and every aspect that is explained by the client. The client may explain very, very sensitive information about her life. And suppose some social worker is working with the sex worker, how he is or he is doing, and the social worker may be working with the ART center, working with the patient of HIV, working with the drug peddlers, working with the many people whose data, whose information is quite sensitive in nature, that need to be protected, and their information, their names and their identity must be taken in confidential, and that not be that's not the things of making it public. If anyone found to be breaching the norms of principle of confidentiality and breaching the principle of confidentiality, so in that case, that social worker may lose the trust of the client, and in that case the social worker may lose the number of clients that is coming to particular social worker for the support, for the solution to that problem, to their problem. Maintaining confidentiality is essential for developing with the client, developing relation with the client, developing trust with the client. If a person who is well to do in providing the confidentiality and winning the trust and the trust of the client, then the client will be easy to share each and everything, and that is needed. Social worker need to practice this principle of confidentiality at 3 levels: at the level of working with the client, at the level of working with the colleague, at the level of working with the organization. If in case of working with the client, whatever the data is coming from the client, that social worker, that professional social worker need to preserve it, need to keep it in confidential. He has no right, he has no choice to make it public. And again, the social worker need to practice this principle of confidentiality with the colleague. If social worker working with some organization and the colleague of his or her may share some of the cases, some of the case study of private in nature, and that confidentiality must be maintained, so he has no right or she has no right to discuss with anyone, discuss her identity with anyone. And at the same time, if a social worker working with a particular organization, organization may have many policy, many information, many documentation. So some policy, some information, some document is need to be private, it need to be not to be public, so that norms, that principle is also applicable at the level of organization, and the social worker need to maintain the confidentiality of information at the level of organization. Next one is principle of non-judgmental attitude is one of the most important principle of the social work. It says that we have no right to be judgmental, we have no right to decide what is right, what is wrong. We have no right to decide what is good, what is bad. We have no right to decide what is ethical, what is unethical. We have to accept our client without any kind of passing judgment. We have to focus on the worth and dignity of a client by the virtue of being a human being. Each and everyone is important, each and everyone is worthful, and we have to respect that. We have to start working, and we have to engage in the social work practice without any kind of blaming. We have to maintain not to blame anything or the non-blaming attitude toward the client. Social work must not judge other good or bad and unworthy and the other things. We cannot judge in what condition he or she may have committed particular crime, or he may be trapped into the particular problem. He may be doing the less effective work because of his inability, because of his laziness, because they are the poor because of their own reason. We are no one to do all these things. Principle of controlled emotional involvement. It says that we are supposed to be neutral, we are supposed to be rational, we are supposed to be non-emotional while we are dealing with our client. We are supposed to be rational with dealing with the client. We are neither going for the highly involved with the client, nor we are going for the less involved in the client. We are supposed to be a very rational practitioner, very rational professional. By this rationality, we can accept our client and we start working with the client. Suppose sometime it may happen with some of the professional social worker that they must have the same experience and the same life situation in their life, and that the client have, and by that social worker may start start inclining emotionally with that client. So since the social worker may may feel associated with the client, that is going to hamper his ability and hamper his understanding and the wisdom to work with that client, and he may not be going to take good decision, and the decision which is quite fruitful and the beneficial for the client. So it is better to not to involve so much that it is going to hamper the working capability of the professional social work. At the same time, we are not supposed to be quite alienated, quite distant with the client when the client is started thinking that this person is not good, I am at wrong place, that I am not feeling associated, I am not feeling connected with that professional social worker. In that case, again, it is going to professional social worker is going to lose their credential in solving their problem. So it is better to understand how to manage an equilibrium between the excessive involvement and the less involvement. We as a professional social worker is supposed to maintain an equilibrium so that we can practice rationally. Otherwise, we are going to hamper the result of our practice. So these are some books and the reference. The student can go for the generalist social work practice and empowering social approach. It is written by the Brenda Du Bois, and there is another option. There is a e-Gyan course that you can refer for your better understanding. Now I am ending my lecture. Thank you very much, viewer, for your patient listening and sparing your time for this lecture. Thank you very much.